Welcome back to Ask Dr. Mingle. It's great to see you again. I am Dr. Dan Mingle, family physician, founder and CEO of Mingle Health. I'm here to answer your questions about value-based care and value-based payment. This is part of a series we're doing this year on the proposed rule for 2026. Reductions in this set include an overall orientation to the rulemaking cycle and extra resources to learn more about the proposed rule, the proposed rules for MIPS and APMs, proposed rules for MIPS Value Pathways, proposals for the Medicare Shared Savings Program, a proposal for the ambulatory specialty model, and a review of Medicare requests for information packaged with this set of proposed rules. Each of these I've packaged as a separate presentation, so you can bite it off in small pieces and focus on just those things in which you're interested. Specific to this section, I'll cover proposed rules for MIPS value pathways, including mandatory subgroup reporting, registration for MVPs and attestation to practice type, sunset of traditional MIPS, new MVPs, and third-party supportive MVPs. When MVPs were introduced, there was an initial proposal that mandatory subgroup reporting would start in the 2025 submission year. That's the year we're in now. But that didn't happen. But in this set of proposed rules, Medicare is proposing to start mandatory subgroup reporting with the 2026 performance years. Now, they've cleared up a lot of what I've considered confusion and misperceptions about what mandatory subgroup reporting will be. And in fact, they've made it clear that it really only pertains to one group of practice types, and that's large multi-specialty groups. It doesn't pertain to anybody else. Starting in 2026 and going as far forward as we can predict, any individual MIPS clinician can choose any MVP. It doesn't form a subgroup, obviously, to do that. Any single specialty group of any size whatsoever can do any MVP that they're eligible to do. And they don't need to form a subgroup to do so. In this proposal, they're suggesting that any small multi-specialty group, that is a group with a practice size of 15 or fewer clinicians, does not have to break into subgroups, can choose as a whole group to do any of the MVPs that they're eligible to do. Any APM entity can do as a group those MVPs that they are eligible to do, and any form subgroup can submit an MVP. Now, part of the confusion around breaking into mandatory subgroups is Medicare remains a little confused about how to determine single specialty or multi-specialty groups and specialty types. There's so much variation in how people treat and register as specialists. The NPPES data set, which shows specialty taxonomy codes in the National Provider Identifier tables, just don't seem to be kept up regularly. Similarly, PICOS, where providers register to be part of the Medicare program to be paid, they collect a specialty designation there. That likewise doesn't seem to always be adequate, as people may be practicing a slightly different scope of care in different practices, and as they move from change from one practice to another, they might be different. They also include a specialty designation on claims, but it's not inserted by the provider. It's inserted by the Medicare intermediary, and it includes details from the claims as well as the PICOS data to determine what that is. So Medicare's a little bit confused about how to determine that multi-specialty and single specialty status. Um, to get around that for this first year and indefinitely beyond that, they're suggesting at the time of registration for the MVP, which can be anywhere between, which begins April 1st and ends November 30th in a typical year, a practice will attest to being a single specialty practice or attest to being a small multi-specialty group status. Other than that, they would be considered a either an individual clinician is obvious. They can choose any MVP, and all the other practices will be large multi-specialty groups, which do need to break into subgroups to do MVP reporting. They still haven't set a date for sunset of traditional MIPS, but suggest that it is coming, and perhaps 2029 will be the year. But again, it's not yet at the level of a proposed rule change. There are 6 new MVPs proposed for the 2026 year: diagnostic radiology, interventional radiology, neuropsychology, pathology, podiatry, and vascular surgery. That those join the 21 already in existence. I won't read those out. You can find them here or get them from the qpp.cms.gov website. Search for Getting Started with MVPs data. Medicare's proposing this year to alter the rules for third-party support of MVPs. They're proposing that any third party that supports MIPS needs to support the MVPs that are applicable to their clients. And they're giving them a year after the introduction of any MVP to build the infrastructure in order to meet that requirement. So not right away, but 1 year after introduction, third parties that support MIPS, that is qualified registries and qualified clinical data registries, are required to support those MVPs. Remember, comments are due by September 12th, 2025. I suggest you enter them online, go to the Federal Register, go to the location of the proposed rule. The link is here on this slide. Choose the green box where it says submit a public comment. It allows you to enter your comment into a box and submit it. I like to submit each of my comments individually. Open a box, make a comment about an issue, close the box, go to the next issue and do it again. I think that just keeps it clean, allows one reviewer to look at the comments regarding one issue and not get confused or off track or lose track of any of my comments. There are other ways to submit. They're listed in the preamble to the proposed rule. But again, I think this is the most efficient and effective. Thanks for joining us today for Ask Dr. Mingle. Use the links here on the right to ask your questions, correct my answers, contribute your experience and comments. We are smarter together. Look forward to seeing you next time.